Hi there, welcome back. So it looks like you enjoyed my first video because you wanted to hear more. So thank you for coming back. And if this is your first time, please hit the subscribe button and also like this video, share with somebody. If you know somebody going through PCOS, sometimes coming from Africa or coming from Ghana, of course, things have advanced now, but growing up, I don't think I ever heard of PCOS. And so there may be people going through infertility issues and they may think, well, it's something spiritual. I'm not downplaying that. And I'm not downplaying medical research as well. Our bodies go through different things. My story may not be your story. At the same time, whatever symptoms and issues and treatment that may work for me may not be the same treatment that may work for you. So, whatever reasoning you're going through for infertility, whether it's through PCOS, whether it's through some kind of medical diagnosis or spiritual or whatever it is, just know that there is hope. There are treatments, there are alternatives, there is hope. So don't give up. I always say that if yours, and I mean children, if yours is in it, if it's God's will that you're going to have it, or have one, or have them, regardless of your diagnosis, God doesn't work. He works in mysterious ways. He doesn't need your cycle to come on for you to get pregnant. He doesn't need you to ovulate for you to get pregnant. So there is hope. And so I'm going to continue with my story, with sharing what my journey with PCOS has been. I'm hoping you watched the first video, how I found out I had PCOS. And I think in that video I did mention the major side symptoms I had was excessive facial hair, weight gain, bloating, and basically those were the only three. There was nothing else, and irregular cycle, of course. My cycle wouldn't come on, and as I mentioned, I wasn't sexually active. I wasn't trying to get pregnant, so I didn't really care if it came on. Actually, I was excited it wasn't coming on. And so this went on for I don't even know how many years. And I just left it alone. And so, what is PCOS? PCOS is polycystic ovarian syndrome. PCOS is a hormonal disorder that most women go through. There hasn't really been what causes it, but it's been some research says diet. Some are saying it's in the family, so we don't actually know what causes it. But like I said, many people experiences different symptoms. Some are irregular cycle, excessive hair growth, acne, weight gain, and this is affecting how a woman's ovary function. And so, and actually, one of the symptoms I had was excessive cysts on my ovaries, and they were so painful. Thinking back to it, and so these cysts around the time that my cycle is supposed to come on, I'll get these cysts on my ovaries. And sometimes when they burst, it is the most painful thing. And so you have this bloating, the cyst on your ovaries, and you can have an ultrasound and you can see all these cysts, sometimes large ones, sometimes small ones. And sometimes they can go into busted depending on how painful it is. But I didn't go through all those things. And so, yes, those were some of the symptoms I had with PCOS. And PCOS is linked with high levels of androgen, which can prevent ovulation and lead to the formation of small follicles. So those follicles or cysts was something I experienced. PCOS also increases the risk of developing insulin resistance. And so, yes, there are some people you can tell or see the dark circles around their neck. Some people sometimes they develop diabetes. And so one of the medication that I was put on when I was diagnosed with PCOS was metformin. If you watch the first video, I'm not a medication person, so that didn't work. I wasn't taking it. So yes, so two diseases that this insulin resistance develop is diabetes and heart disease. So for you to manage it, it's a combination of lifestyle change and exercise, and it is somebody with PCOS is very difficult to lose weight. Dietary can be very tricky because some are saying don't eat red meat, some are saying just vegetables and does. It can be very tricky and very stressful. But mainly that is the treatment for it. There are medication to help control it. With the metformin, it was just to control the insulin resistance to prevent me from getting diabetes, and also metformin I understand helps you lose weight. So it was both. So mainly PCOS is controlled or managed with medication, diet, lifestyle change, which is diet, exercise. Those are the only things that can. Hopefully, if you are able to lose weight, then the body gets back into rhythm or gets back into normalcy, whatever the normalcy is. So symptoms include irregular or missed cycles or missed periods. Cycles may be longer than 35 days or missed entirely. Mine was missed entirely. I'll go months without a cycle. Excessive hair growth. Actually, I still experience excessive hair growth. It became so annoying that I was even thinking of is the laser treatment. I've tried um, hair removal creams. I used to shave, and now I have these dark areas around my neck. So I wanted to move from shaving and just use hair removal creams or laser. It is annoying. I have to shave every other day. It is annoying. When I was younger, I didn't really care, but now that I'm getting older, it's just annoying. Acne, oily skin, weight gain, difficulty getting pregnant, and other symptoms are skin tags or patches or dark spots on the neck and also the arm. I didn't really have any of these. I didn't have issues with patches or tags or under my arm. I do have couple, but I didn't know it actually was related to PCOS. So that's interesting to know. But um, yeah, so this is PCOS, and so this is what I lived with. Now I'm sharing this story because my body somehow miraculously went back to normalcy. And so this is the purpose of this video, to share my journey before it went back to normalcy. So I hope you come back to check out the other videos. If you haven't already subscribed or liked, please click below.